Okay, Bismillahirrahmanirrahim. This is our part 2. Question number 11. We are starting from a 16-year-old boy received a superficial cut on the lateral side of his foot while playing football and is admitted to the emergency department where the wound is sutured. 4 days later, the patient returned to the hospital with high fever and swollen lymph nodes. Which group of lymph nodes will first receive lymph from the infected wound? Obviously, for lymph from the lateral foot, small saphenous drains first to the popliteal nodes, then it is going to drain to the deep inguinal nodes, which can be your second MCQ. Okay, you have to prepare the MCQs like this. Question number 12 says a 45-year-old man presents at the local emergency clinic with complaint of a painful knee and difficulty in walking. A CT computed topography scan examination reveals a very large cyst in the popliteal fossa compressing the tibial nerve. Which movement will most likely to get effect? The tibial nerve innervates the tibial nerve in the popliteal fossa supplies the plantar flexors, that is gastrocnemius, soleus, and tibialis posterior, and sole toe flexors function, compression weakness, plantar flexion. The answer is E, that is plantar flexion of the foot is going to be affected. Now the question number 13 is a 19-year-old football player was hit on a lateral side of his knee just as he put the foot on the ground. He is unable to walk without assistance. He is taken to the hospital. An MRI was done and on examination reveals a torn medial collateral ligament. Which structure would most likely to get injured due to the attachment to the ligament? That is the MCL. MCL is medial cruciate ligament, which is firmly attached to the medial meniscus. A valgus injury tearing the medial collateral ligament. Commonly injures the medial meniscus too. Now talks about the question number 14, that is a 49-year-old man underwent a coronary bypass graft procedure using the great saphenous vein. Post-operatively, the patient complained of pain and general lack of normal sensation on the medial side of the leg and foot on the limb from which the graft was harvested. Which nerve was most likely injured during the surgery? Obviously, harvesting the great saphenous vein risks the which nerve? Adjacent, the saphenous nerve is present, which supplies the medial leg and foot. So there will be the sensory loss of the medial leg and the foot. This is how you are going to identify the answer. Now let's talk about the question number 15. A 22-year-old football player is admitted to the hospital with pain and swelling over the lateral aspect of the ankle. The emergency department doctor diagnoses an inversion sprain. Which ligament was most likely to get injured? Now, which ligament is injured? And inversion sprains injures the lateral ligament complex, most commonly ATFL first. Next is the calcaneofibular ligament. The answer is B, calcaneofibular ligament. Okay. Now question number 16 is a 72-year-old woman is admitted to the hospital with a painful right foot. A CT scan examination reveals a thrombotic occlusion of the femoral artery in the proximal part of the adductor canal. Which artery will most likely provide blood supply to the leg through the genicular anastomosis? Now the answer is B. B is descending branch of the lateral circumflex femoral. Occlusion in the proximal adductor canal blocks the femoral artery before it reaches the popliteal artery. So blood can still reach the popliteal artery by the genicular anastomosis, which is fed by the descending branch of the lateral circumflex femoral and the descending genicular branch. The descending branch of the lateral circumflex femoral is the main collateral in this situation. Now comes to the question number 17, that is a 75-year-old woman is admitted to the hospital after falling in her bathroom. Radiological examination reveals an extracapsular fracture of the femoral neck. Which artery is most likely to get injured? On the femoral neck, which artery is present? The medial circumflex artery is the major blood supply to the head and neck of the femur. It is an extracapsular fracture of the femoral neck. This vessel is highly vulnerable and the damage can lead to the avascular necrosis of the femoral head. This is how you are going to identify the answer or eliminate the other options. Now let's talk about question number 18, that is a 56-year-old man with advanced bladder carcinoma suffers from difficulty while walking. Muscle testing reveals weakened adductors of the right thigh, which is the most likely being compressed by the tumor to resulting that results in difficulty in walking. Now, which muscle is this? Which nerve is this? Obturator nerve. L2 to L4 that innervates the adductor muscles of the thigh. Compression from a pelvic bladder tumor can weaken the adduction, making walking unstable. So 3 MCQs can be made by this scenario or this question. Okay, keep that thing in your mind. Okay, question number 19 says, upon removal of a knee high leg cast, a 15-year-old boy complains of numbness of the dorsum of his right foot and inability to dorsiflex and invert his foot. What is the most probable site of the nerve compression that resulted in these symptoms? The common fibular nerve winds around the neck of the fibula, so it means that the neck of the fibula is the most common part or the position that is it is that part where the injury takes place. So the common fibular nerve is responsible for it, which causes inability to there is inability to dorsiflex and eversion of the foot. Where is the common fibular nerve winds around the neck of the fibula, which is very superficial and prone to compression, for example by a cast. Injury, loss of dorsiflexion, that is foot drop, eversion and sensation on the dorsum of the foot. Now let's talk about the question number 20. A 32-year-old patient received a badly placed intramuscular or IM injection to the posterior part of his gluteal region. The needle injured a motor nerve in the area. Later he had great difficulty rising to a standing position from a seated position. Which muscle was most likely affected by the injury? Inferior gluteal nerve supply the gluteus maximus muscle, the chief extensor of the hip. This is another MCQ, which is the chief extensor of the hip. Gluteus maximus is the chief extensor of the hip, and in the OSPE, gluteus maximus is usually marked, and it is also asked in your OSPE as well. Its damage can lead or it takes place when the injection is given. Injury in the lower medial quadrant of the buttock causes difficulty rising from the seated position or the climbing stairs. 3 to 4 MCQs can be made by this MCQ. That is, and the answer of this question is A, that is gluteus maximus. And gluteus maximus is supplied by which nerve? The inferior gluteal nerve. Okay. So this is our part 2.